Well, to begin with, I'm an adolescent medicine physician, and so a lot of the research ideas that we develop come from experiences in clinic. And as you can imagine, over the last 5 years or so, we've seen a lot of patients in clinic who are very concerned about cyberbullying. Either they've had experiences or they've seen peers that have had experiences. And it's also been a time over the last 5 years where we've seen an explosion in news coverage related to cyberbullying, as well as a growing area of research. One of the things that's really interested me in trying to understand cyberbullying is the idea that so many different research teams are using different definitions when they study it. And so that really affects the types of answers they get, and it also affects our understanding of how common a problem cyberbullying is. So if one researcher uses a question such as, have you ever experienced cyberbullying, which we define as mean things online, well, most every kid has seen something that they would define as mean things online. And so in that type of study, you might see a prevalence rate of 72%. But in another study where they define cyberbullying very narrowly, saying things such as harassing messages on chat rooms. Well, not many kids have had that experience, and so in that study, the prevalence might be very low. So it's very difficult to get a sense of how common this problem is. One thing we hear from our educator colleagues is that they have school policies that explain what should happen if someone is cyberbullied. But there's a wide variation even within a single school on what they think cyberbullying is. So a lot of times the responsibility falls to the youth to say, did I get cyberbullied or didn't I? And a youth who's embarrassed or who doesn't want to report, that might not be able to trigger the things that are supposed to happen for someone who's been cyberbullied. So our hope is that using a consistent definition that's built out of data that comes from youth and educators will help schools be able to apply it into practice. And so the study design that we chose is called concept mapping, and it's a method that's been used in the public health literature, particularly in the nursing literature. A lot of good scholarship comes out of the nursing literature, and it allows you to bring in stakeholder views. And a real cornerstone of the process is that you involve these stakeholders in each phase of the data collection. So that allowed us to involve each of those stakeholder types: healthcare providers, educators, youth, their families, as well as the legal system. Now we're at the point that we've developed a concept map. We've used that map to create a diagram that almost looks like what we would call a flow diagram in epidemiology, where we can work with a participant or a stakeholder and look at the process of how bullying might happen. Who might be at risk? What are the different types of behaviors that are unique to bullying as well as cyberbullying, as well as the behaviors that overlap? And what are some of the consequences? And so we're very excited about this idea of this flow diagram, because we feel like we can use that towards a definition of cyberbullying, as well as towards the possibility of a measurement tool, so that future research studies have an item that measures cyberbullying in a way that makes sense to them, but that other researchers can use as well. So hopefully we're all speaking the same language when we're talking to participants.